So let's understand what happens during the hip replacement surgery and after it. And I'm going to break it into 5 components for easier understanding of all of you. So the first part is when the patient is in the recovery area before the surgery. From there, the patient is wheeled in to the operation room. Why do we say wheeled in? Because you are on a bed, you are lying on it, and we wheel you inside the theater. First thing which happens when you're inside the theater is your anesthesia. And in all the cases, me and my anesthesia team has already discussed the type of anesthesia which we'll be giving to you. It could be a spinal anesthesia, it could be a combined spinal with an epidural anesthesia, or it could be a general anesthesia. We recently made a video on it, which is titled "What type of anesthesia is required for a total hip replacement surgery?" You can go and watch it on my channel. Once the anesthesia is done, you stop feeling your legs if it is spinal or epidural. And if you are under general anesthesia, then you don't have any awareness of what's happening inside the theater. Then you are positioned for the surgery. If I'm doing your surgery by posterior approach, it means that you're lying on your side. And if I'm doing your surgery by direct anterior approach, then you're lying down straight, which means like you sleep on your back. The second thing which happens is your surgery, in which I have touched upon the type of approach we are going to use, and that can be different for different people. Minimally invasive surgery is one thing which leads to minimal damage to the tissues inside. Whether it is anterior approach or a posterior approach, if the tissues inside are damaged minimally, then the patients recover faster. So that is our objective in every single hip replacement surgery which we do. And then let me touch upon the duration of the surgery. The actual duration of the surgery is 60 minutes to 75 minutes on an average. It can get finished before that also and can take little longer also, depending upon multiple patient factors, the complexity of the case, the body weight of the patient, and some such other factors. Now let's say the surgery took 75 minutes, which is 1 hour 15 minutes, but the patient might be inside the operation theater for 3 hours approximately. Your anesthesia is done, then the positioning is done, then cleaning is done, then draping is done, and then the surgery started. And after the surgery, the dressing is done, then your position is changed, and then you are observed for a while inside the operation room. After you have been observed for some time by my anesthesia team, then only you are shifted back into the recovery area. Before we dive deep into this video, I would want you to understand that whatever timelines I'm going to discuss in this video are what I practice. Every surgeon has their own protocols, and I would want you to respect what your surgeon wants you to do. Having said that, I hope this video will give you some insights into what happens during and after the surgery. Let's dive in now. Then we come to point number 2, which is what happens immediately after the surgery. You are wheeled back into the recovery area where your vitals are monitored by my team. We check what is your blood pressure, what is your heart rate, and multiple other such parameters which are important for your safety. These parameters are monitored. Your pain management is done. Generally, patients who are under spinal or epidural anesthesia, they do not feel the pain immediately because their body parts, their legs are still numb. But people who have undergone a surgery under general anesthesia, my anesthesia team gives special kind of nerve blocks which take care of the pain. At the same time, as soon as the power is back in the legs, my physiotherapy team comes, they make you move your limb in the bed, and if you are comfortable, they make you sit and walk few steps, and that can vary from patients to patient. Few patients may feel giddy when they kind of sit up, and we really do not push every patient to walk immediately, but the patients who are comfortable, who are motivated to walk as soon as possible, we make them stand and walk. Number 3 is pain management. Pain management is done by my anesthesia team and the nursing staff who administer those medications to you. If you are under epidural anesthesia, then some drugs are given to you through the epidural catheter. So we see to it that after the surgery you are comfortable and pain is not bothering you, so that we can mobilize you as early as possible. Early mobilization also helps us in taking care of the problems which can happen because of prolonged lying down, like clotting of blood in the legs. So as soon as you are out of the operation room, and as soon as the power in the legs return, we want you to stand and walk so that the blood starts flowing in the veins and there is no stagnation of the blood in your legs. And that brings me to the point number 4, which is physical therapy and rehabilitation. As soon as you are comfortable, you are walking around on the day of surgery, you are kept under observation, and on the next day, when only maybe 16 hours have passed since your surgery, my physiotherapy team will come and make you stand and walk again. And most of my patients are very comfortable. We want you to walk, we want you to move as early as you can. That is the primary objective of the surgery. Pain-free mobility. And then the point number 5, which is returning home. These days we have easy availability of elevated toilet seats, which you can order from Amazon or any such platform, and then you put it on your toilet seat and it elevates the seat by 6 inches or so, and that makes it comfortable for you to sit on it. Besides this, the other challenge is to take a shower after the surgery. If we give you waterproof dressing, which we do for a lot of our patients, then you just need to be careful with your dressing, but you can take a bath and the water doesn't go inside the dressing. But let's say you've undergone a surgery and your post-operative dressing is not waterproof, then you have to take care of it. You can do body sponging, you can do your head bath and protect the dressing for, let's say, 2 weeks. And after 2 weeks, when your dressing is removed, and if the stitches are dry, most of my patients get a stitchless closure where the staples need not to be removed, and then you can take a shower the same day. My team assists you with the decision of when to take a shower, because we ask for certain pictures from you of your surgical site, of your dressing, inside and outside picture, and that is a standard protocol which we follow for all the patients who are coming from other states of India. So these were the top 5 points I would want you to know about which happened during and after the surgery. But let me give you one bonus: following up with your surgeon on a regular basis. We usually call our patients after a fixed number of weeks so that we can see how you're doing, what are your challenges, how we micromanage your recovery, which can happen at 6 weeks and then at 3 months or 6 months, depends on the case. But following up with your doctor and following all the instructions is extremely important before you go back to a normal pain-free life, before you enjoy your life to the fullest, and before you become an avian warrior. Thank you so much for watching. I hope you found a lot of value in this video, and for more such videos you can search on my channel or you can put a comment in the comment section and we'll get back to you. Thank you so much.